Hello everyone. Today Zinzi and I will be taking you through our presentation that we have collaboratively prepared for you on the systems approach to scaling up. We will begin off with some explanation on health systems and the importance of interconnections and relationships, moving on to explaining what scaling up means. From here we will give you a short brief progress update on the work undertaken by the upscaling working group. And Zinzi will present two short case studies to explain or show the diversity that comes from scaling up, finally wrapping up with lessons learned and any key messages. In this slide, I'd like to first begin off by talking about how, as a health system, we all work together with a whole large number of people. And this image has been adapted from Don D. Savigny and Tagreed Adams' paper on systems thinking for health systems strengthening. On the outer circles, there are 6 outer circles which are the building blocks of health systems, and this was defined by the World Health Organization. And these include governance, information, financing, service delivery, human resources, and medicines and technology. And in this image, as you can see, what they have tried to highlight is that the people representing each of these different building blocks actually must interact constantly in order to deliver a service for the people. And it is these interactions that actually shape any health system's functioning. In order to explain this interconnectedness, I have prepared a small example, and let me take you through this. So let us suppose that there's a country X which does not have a national policy or an action plan for managing diabetes or any NCDs more broadly. Well, this could mean one of the impacts could be that the workforce is not trained in prevention and screening of diabetes, and there's no infrastructure or guidelines for NCD management. Well, this lack of clarity could mean that there's inconsistent and variable budget allocation towards the management of these conditions, which could subsequently have an impact on the procurement of drugs. And if people are not going to get drugs at their health center, it's unlikely that they will visit their public health system or a health center, primary health care center. And therefore, the country may not have a good baseline data or does not have an information system on the prevalence of diabetes or hypertension. I'm sorry, this image might not be visible to you all, but I wanted to highlight here that it means that the service delivery, there'd be huge frustration for the frontline workers, for the clinicians, for the multitude of staff. The patients would be frustrated, and there would be no trust within the health system. And overall, there's an impact for all the people, and there's reduced access to diabetes screening, treatment, management, and control, leading to a lot of pressure at all levels. I hope through this figure I'll be able to explain about the importance of relationships and about working together. So it is actually impossible to implement. Let us assume we are going to implement a technology, an app that is going to improve screening. It is going to actually have a fallout effect across the system, and we need to, as researchers, plan for this holistically and not just look at a narrow way of just our intervention alone. I hope I have explained to you about the complexity of these relationships and the importance of understanding these interactions. And most importantly, any process is unpredictable and non-linear, which is important that feedback loops and adaptive mechanisms are built into our research process particularly when we plan implementation of and scaling up at the health system level. In this slide, I'd like to highlight the important role of the context, the broader environment within which the health system functions. And as you all know, and as we all know, that the health system doesn't operate independently, and the government and the policy context, for example, has got a huge influence to play on the functioning of the health system, as do non-government organizations Well, the community context is critical, as is the availability of technology and infrastructure such as internet or even simple things like electricity. Funding is paramount, as is the political stability of a country. So together we can see that when we deal with a health system, any implementation within a health system, we not only have to look at the health system, which is really complex, we look at the broader system as well, which includes another layer of complexity and multiple stakeholders who are in this process. In this slide, I'd like to take you through what scale up means. I'll give you a few seconds to actually read this definition by the World Health Organization. Now let me unpack some of these in very simple terminology. Well, deliberate efforts means that we require systematic planning to make something more useful by providing scientific evidence so that more people can be reached by that particular intervention and the delivery is fair and equitable with, for all the people who are involved in the region. Scaling up is very closely connected with embedding within the policy and practice changes so that changes can truly be sustainable. So I hope I have been able to explain that scale up is much more complex than just large scale implementation. And it is about increasing the coverage and reach, yes, of interventions, but we need to pay crucial attention to the context. We have to have very evidence-based, localized planning. The program has to be equitable and there have to be quality and fidelity standards to be built over time. And as mentioned earlier, it has to be non-discriminatory for people so that anybody has equal access and not discriminated based on geography, gender, or religion. This is possibly a repeat, so I'll just let you just see that for a minute. And we talk about the importance of the context, the importance of the intervention, and the importance of understanding the outcomes for all the stakeholders in that context. So what is the role of scale-up research? Well, if in this diagram, like on the left-hand side, you see that there's an evidence-based intervention that is reaching a small number of people within a certain region. And if we know that works, then scaling up is the process of actually building it, taking it across more regions, or it may mean including more people within each region. Now, I know there's a separate lecture that is being delivered around scaling up and scaling out, and these issues will be discussed more there. But through this illustration, I just want to highlight that this arrow here, the gray arrow, is really that scale-up research process, which takes an intervention from a small scale to a larger scale across different contexts. Much of our lessons till date on this topic that we are sharing is because of the joint research being conducted by the Upscaling Working Group members. It is a group that came together to collectively study the 27 research projects that were funded in 2019. In the first phase, we looked at the planning and we extracted data from 21 studies and presented summary statistics complemented by some funder interviews. In the early implementation phase, we looked at 44 multi-stakeholder interviews from across 19 studies, and our goal was to try and understand any patterns of challenges and facilitators from across these studies. Interestingly, the study was conducted between June 2020 and August 2021, when COVID-19 was just rolling out or just at its peak impact. And we were able to capture some of these major impacts due to COVID-19, but also importantly, reflect on some of the lessons learned on how these studies navigated COVID-19 pandemic. We are currently, actually Zinzi and team are currently studying the late implementation phase of these studies, and they have completed data extraction and also multi-stakeholder interviews. Their paper is currently being written up. I'll now pass the baton over to Zinzi to talk you through the remaining of this presentation. Thank you from my end.
Hi everybody. So as Anusha mentioned before, I will take you to two case studies showing the diversity of system thinking approaches of scaling up. So the first case study is the Sunny-C project, which stands for Scaling Up Non-Communicable Disease Interventions in Southeast Asia. So this project entailed scaling up health interventions in diverse resource-constrained settings across Southeast Asia. The project tackled the rising burden of non-communicable diseases like diabetes and hypertension in Vietnam, Indonesia, and Myanmar. The primary objectives of the project were to strengthen the prevention and control measures for NCDs, to enhance the capacity of primary healthcare systems, and to build sustainable, evidence-based models for scaling up interventions. So the Sunny-C project adopted a system thinking framework which emphasizes the interconnectedness of healthcare system components. This approach helped the project to address critical challenges, such as, first of all, the workforce capacity. So by improving training programs to equip these healthcare workers with the skills needed for prevention and management of NCDs. And also the drug supply chain, so by streamlining processes to ensure consistent availability of essential medicines. And lastly, by patient engagement, so by really fostering these community-based programs that empower individuals to participate actively in managing their own health. Central to the project's success was its emphasis on engaging diverse stakeholders, including stakeholders, healthcare providers, local communities. This collaboration really ensured that these interventions were co-created, contextually relevant, and more likely to be accepted and sustained. Sunny-C project made a significant progress in several areas. So first of all, increased screening rates for diabetes and hypertension in the target region. Secondly, also enhanced training programs for healthcare workers, improving their capacity to deliver effective care. And lastly, the established community-driven health programs to provide ongoing support for NCD management. Despite these achievements, the project really faced challenges, such as ensuring the long-term sustainability of interventions and addressing disparities in healthcare access, especially in remote or underserved areas. So the key lessons from the Sunny-C project were that early engagement with local communities improved the acceptance and effectiveness of interventions. And also adapting interventions to local context while retraining their core elements really ensures that they remain impactful. So this Sunny-C project highlights the power of system thinking approaches, demonstrating that with strong stakeholder collaboration, it is possible to scale up health interventions effectively, even in diverse and resource-limited environments. Another example of system thinking in action is the Bangladesh Declare project. This project focused on scaling up interventions for diabetes management in rural Bangladesh. The project emphasized on collaboration with key stakeholders and a system thinking approach to scaling up the health intervention. So to scale up this intervention, collaboration with key partners like the Diabetic Association of Bangladesh and policymakers was crucial. By working with national stakeholders, the project aimed to integrate the intervention into a wider healthcare delivery models across the whole country. Moreover, as part of the scale-up efforts, the project is now looking into expanding into urban high-risk populations, really using the lessons learned in these rural areas to adapt the models to different contexts. So the lessons learned from this project is that effective scaling up really requires community ownership and policy alignment. And flexible implementation is critical in navigating systematic challenges like the COVID-19 pandemic. Part of the upscaling working group that Anusha introduced earlier, we are now studying the implementation phase. We analyzed 15 projects funded by the Global Alliance for Chronic Diseases, spanning over 18 countries. These projects focused all on scaling up interventions for non-communicable diseases And in this study, we focused on the enablers and barriers of sustainable scaling up interventions across diverse global settings. So on the enabler side, the study emphasized that adaptability is critical. Interventions tailored to local contexts were better accepted by communities and more sustainable over time. Moreover, the use of digital health tools also emerged as a significant facilitator, particularly in resource-constrained settings, as these tools help to enhance the communication, the data management, and the service delivery. We also found that early and ongoing stakeholder engagement played a crucial role in fostering local ownership and ensuring long-term success. However, the study also identified several barriers. First of all, resource limitations, both financial and infrastructural, were significant hurdles, particularly in low and middle income countries. Cultural resistance was another common challenge, especially when interventions did not align with local norms and practices. And finally, political instability and frequent changes in governance disrupted the continuity and the scalability of interventions in several regions. So in summary, scaling up NCD interventions really requires a focus on context-specific and adaptable models, sustainable financial mechanisms, and building strong, resilient partnerships to navigate systematic challenges. So as these case studies have shown, and this study that we're now working on, scaling up interventions is not just about replicating a successful program on a larger scale, but it really involves addressing a range of complexities. To be prepared and to address these different complexities, frameworks and theories can be adopted at various stages of scaling up research and planning. So these frameworks provide structured guidance to ensure interventions are effective, scalable, and sustainable. For example, you could use a logic framework for the project preparation. So the logic framework really helps in the early stages of planning by clearly defining objectives, inputs, activities, outputs, and outcomes. So for instance, you can outline the specific steps needed to train healthcare workers and to establish monitoring systems, ensuring alignment with broader health goals. You could also use evaluation frameworks regarding process and impact. So during and after implementation, these evaluation frameworks are essential to assess both the process and the impact. Process evaluation examine how these interventions were implemented, whether timelines were adhered to, resources were used effectively, and barriers were encountered. You could also look into the stakeholder mapping and engagement. This can help identify key stakeholders and their roles and their influence. This ensures their active participation from policymakers, from healthcare providers, communities, really fostering this ownership and the long-term success. And then there are also cost-effectiveness frameworks. So these models really help to assess whether the intervention delivers the value for money, ensuring that resources are allocated efficiently. So for example, the dynamic sustainable framework, which emphasizes continuous adaptation to changing context over time, ensuring interventions remain relevant and effective even as conditions evolve. And then there are the implementation frameworks. Implementation frameworks can guide you in the actual process of rolling out the intervention. Implementation framework can help translating the planning into action, ensuring that these interventions are adapted to local context and executed with fidelity. They emphasize the key elements such as the resource allocation, the workforce capacity, system integration, and monitoring. So for example, you could use the consolidated framework for implementation research. This really offers a systematic approach to identify factors that influence the success or failure of implementation. So all of these frameworks really ensure that the intervention is implementing consistently, efficiently, and in a way that maximizes effectiveness. So each of these frameworks addresses specific aspects of scaling up, from preparation and implementation to evaluation and sustainability. By selecting the appropriate framework for each phase, we can navigate the complexities of scaling up more effectively. And of course, there are frameworks that can be used for scaling up process. So these scale-up frameworks are designed to help us navigate the complexities of scaling up interventions by providing structured approaches. There are a lot of different frameworks, each tailored to specific aspects of scale-up. from planning to implementation to evaluation. So for example, there's the ExpandNet conceptual and operational framework. This framework was developed specifically for scaling up health intervention. It emphasizes both the conceptual and operational dimensions, and it focused on designing innovations for scalability, developing scaling up strategies, and managing the process to ensure sustainability. So for example, it encourages tailoring interventions to a local context while maintaining their core effectiveness. Or the IHI framework for scaling up. This is a 4-step guide which includes preparing for scaling up, testing interventions in new settings, refining them, and planning for widespread adoption. The framework also emphasizes on stakeholder engagement and system-wide alignment as crucial components. So each of these frameworks really offers unique strengths, and the choice of which to use really depends on the context, but also the goals of the scaling up process. So in practice, it's often helpful to combine elements from multiple frameworks to address different aspects of scaling up journey. But what all these frameworks have in common is that they are dynamic. Here you see some of the frameworks that I've just mentioned, and while looking distinct, they share this common characteristic, the dynamic flow, which shows that these frameworks aren't static checklists. They evolve with the system, ensuring that the scaling up efforts remain responsive to emerging needs or priorities. This shows that scaling up is not a straightforward or static process. It's a fluid and ever-changing. It needs to be adaptable to changing contexts, to new challenges, unexpected feedback, emerging opportunities, and changing environments. These frameworks mirror the complexity of the system they operate within and provide the adaptability needed for sustainable and equitable health outcomes. To summarize, the effective scale-up requires system thinking principles, which emphasizes understanding the interconnectedness of all these elements. So the key messages of these presentations are to begin planning for scaling up early. So in system thinking, it means designing these interventions with scalability in mind, considering how they interact with each other in parts of the system. Secondly, identify the goal of scale up. Be clear on the purpose. Is it to advocate for policy change, to improve processes, to mobilize resources? Each goal will shape the strategy and action required. So for example, advocacy may prioritize stakeholder engagement, while process improvement might focus on the workforce training. Third, stakeholder connections. This is critical for cohesive action. Systems are made of diverse stakeholders with overlapping responsibilities. Engaging them early, fostering collaboration, reduces resistance, and ensures that all components of the system work toward a common goal. And fourth, research activities are essential at every stage of planning, from planning to process. So this really provides the evidence needed to make these informed decisions and adapt the strategies where needed. And building on the previous point, so the fifth key message is that contextual adaptation of these interventions is essential, but retrained to the core elements. Every health system operates within a unique context, influenced by governments, cultural norms, local capacities. While the core of the interventions remain intact, adapting these contextual factors ensures that the intervention integrates effectively without disrupting other system components. Another important message is to start with the low-hanging fruits. These early wins can serve as exemplars, demonstrating and building momentum for broader implementation. Also, plan early to make changes in policy or practice. Embedding changes into policy or routine practices helps to secure sustainability. And last, influential leaders or champions within the project can really drive change. Their role is critical in overcoming resistance and inspiring confidence among stakeholders. So we have drawn on various credible sources. These references are available for those who would like to explore the topic a bit further. And as we conclude this presentation, we would like to take a moment to really acknowledge the many individuals and organizations that contributed to the success of scale-up efforts discussed today. We would like to thank all the Scale-Up Studies team members and participants. We would also really like to give a special thanks to all the upscaling working group members who contributed highly to the work that has been done, and their expertise is highly appreciated. Last, we would like to give a big thanks to the GACD for the generous support, facilitating collaboration, providing resources, and ensuring that all the lessons learned from the projects are disseminated widely. And we would like to end with a note that scaling up interventions is not a one-time effort. It's an ongoing process requiring sustained commitment and adaptive thinking. If there are any follow-up questions, please feel free to contact Anusha or myself. You can find our contact details presented on the slide below. Now, thank you all very much for your time, attention, and engagement.